Good day. I'm Dr. Joel Brill. I am the RUC advisor for the AGA. And for the next few moments, on behalf of the AGA and the ASGE, I'll be presenting a brief webinar on understanding the RUC survey process. Next, please. Now, first and foremost, to those of you who are watching this, thank you so much for participating. Your participation in this RUC survey process is essential to establishing fair professional work values and accurate time and complexity estimates for the procedures that are being surveyed. Next, please. Over the next few moments, we'll be going over understanding the basics of the RUC survey. Will I go through the purpose of the survey, who does what, breaking down the survey into 7 easy steps, if you still have questions, and what happens next. Next, please. So why are these surveys being conducted? The AGA and the ASGE need your help to assure that relative values will be accurately and fairly presented to the Centers for Medicare and Medicaid Services, or CMS, during this process. This is important to you and other physicians because these values determine the rate at which Medicare and other payers reimburse for procedures. Next, please. When are the responses due? For this series of surveys, we would appreciate it if you would submit your response by no later than December the 5th at midnight. You will not be able to submit a survey response after the deadline. That's because the data needs to be analyzed before it can be submitted to the RUC with recommendations from the GI societies. Next, please. So the purpose of the survey is to obtain estimates of the time and complexity required in performing a procedure, and to obtain an estimate of a recommended professional work value. Next. The survey asks you to compare the time, the complexity, and the physician work of the surveyed procedure and compare it to an existing procedure. A list of potential reference procedures is being provided to you for comparison purposes. Next. AGA and ASGE are conducting RUC surveys on the following procedures. Based on data from the surveys, the societies will recommend a work value to the RUC. So for esophagoscopy, there will be a series of new codes surveyed. For EGD, 20 existing codes and 5 new codes will be surveyed. Next, please. So the new esophagoscopy codes being surveyed are a code for esophagoscopy with endoscopic mucosal resection, esophagoscopy with retrograde dilation, esophagoscopy with balloon dilation of 30 millimeters or larger, esophagoscopy with stent placement, and this includes both pre- and post-dilation, and esophagoscopy with ablation. Next, please. The existing EGD codes in the 43235 through 43259 series will be surveyed, as well as new codes for EGD with endoscopic mucosal resection, EGD with balloon dilation of 30 millimeters or larger, EGD with stent placement, again including both pre- and post-dilation, and EGD with ablation. Next, please. So, who does what? Well, the AMA Specialty Society RVS Update Committee, or the RUC, oversees the survey process of the codes, and it recommends physician work and practice expense values to Medicare. The specialty societies and associations, such as ASGE and AGA, coordinate the process for our respective professions, distribute the work surveys to our members to obtain physician work and practice expense data, and they crunch the data and submit the survey results to the AMA's RUC. Next, please. The specialty societies submit recommendations to the RUC for, as you've heard, physician work, practice expense inputs, and professional liability insurance crosswalks. These recommendations are presented at the RUC meetings. These meetings occur 3 times a year. Next, please. The RUC sends its recommendations for physician work values, practice expense inputs, and liability insurance crosswalks to Medicare in May. These will remain confidential until Medicare publishes the Medicare Physician Fee Schedule final rule in November. The values then go into effect in January of the following year. Next, please. So the survey process is actually 7 easy steps. Step 1, you'll review the code descriptor and a vignette, which is a short description of the patient. In step 2, we'll ask you to review the introduction and complete your contact information. In step 3, you will be asked to identify a reference procedure. In step 4, we'll ask you to estimate your time. In step 5, you'll be asked to compare the surveyed procedure to a reference procedure. Step 6, you'll be asked to address a question about moderate sedation in the procedure. And in step 7, you'll estimate your work relative value. So let's go forward. Next, please. Step 1 is to review the code descriptor in the vignette. The vignette has been developed to describe a typical clinical scenario for the procedure. Now, we recognize that you may have performed the procedure on a patient different than the typical one described in the vignette, but that's okay. You can still use your experience to guide your responses. Next. You'll be asked to complete the survey instrument using the typical patient described in the vignette. And the survey instrument allows you to indicate if you do not believe that the vignette provided describes your typical patient. You'll have the opportunity to provide a description of your typical patient at that time. Next, please. In step 2, you'll be asked to review the introduction and complete your contact information. Now, keep in mind that although contact and basic practice information is being collected, your name is never forwarded to the AMA or used for tracking purposes. And should you have any questions about the survey process, you can contact Society staff, Leslie Narramore, L-N-A-R-R-A-M-O-R-E, at gaster.org, 410-349-7455, or Sam Reynolds, ASGE, S. Reynolds, R-E-Y-N-O-L-D-S, at asge.org, 630-570-5643. Next. In step 3, we'll ask you to identify a reference procedure. Now, you'll be provided with a list of reference service procedures. We ask you to select a procedure from this list that is most similar in time and work to the CPT code descriptor and the typical patient or service described. And this is for both the new codes as well as for existing codes being surveyed. The reference procedure that you select does not have to be equal in work, in your judgment, to the surveyed procedure, but it should be similar in work. Next. In step 4, we'll ask you to estimate your time. So using the vignette for the surveyed service, please estimate how much time it takes you to perform the procedure for the typical patient. While certain patients may require additional time and effort, the survey is intended to estimate the work for the typical patient, and your estimate of time should be based on your personal experience with this procedure. Next, please. Now, some questions that always come up is, what do the service periods mean? So we'll go through those right now. The pre-service period includes physician services provided from the day before the operative procedure until the time of the operative procedure. Please note that the administration of moderate sedation is included in the pre-service period. Next, please. So the pre-service period includes assessment of the patient's status for indications, contraindications, and fitness to undergo the endoscopy procedure. It may include procedural workup, a review of records, communicating with other professionals, patient and family, coordinating scheduling and preparation, and obtaining consent. Dressing, scrubbing, and waiting before the operative procedure, preparing the patient and needed equipment for the operative procedure, positioning the patient, and other non-first scope in to last scope out work in the operating room is also part of the pre-service period. Next, please. The pre-service period includes an assessment of the patient's fitness for administration of moderate sedation if this is personally administered or supervised by the endoscopist. All time for the administration of moderate sedation, from the first dose administered until the endoscopic procedure begins, if necessary, if personally administered or supervised by the endoscopist, including management of sedation, is part of the pre-service period. Next, please. So the pre-service period does not include the consultation or evaluation at which time the decision to provide the procedure was made. It does not include any distinct evaluation and management services provided in addition to the procedure. It does not include any mandated services, and it does not include staff time, such as time to schedule the procedure or provide instructions to the patient and the like. Next, please. The intra-service period includes all physician first scope in to last scope out work that is a necessary part of the procedure. Next. And the post-service period includes physician services provided on the day of the procedure after the procedure has been performed. Next, please. So the post-service period includes non-first scope in to last scope out work in the operating room, includes patient stabilization in the recovery room or special unit, communicating with the patient and other professionals, which can include written and telephone reports and orders, and patient visits on the day of the operative procedure. The post-service period includes an assessment for fitness to discharge from the procedure area when that is performed by the physician, and it includes discharge instructions and counseling to the patient and caregivers when that is performed by the physician. Next. The post-service period does not include unrelated evaluation and management services provided during the post-operative period. It does not include a return to the operating room for a related procedure during the post-operative procedure, nor does it include an unrelated procedure or service performed by the same physician during the post-operative period. And the post-operative period does not include calling the patient and communicating lab results. Next, please. In step 5, you will be asked to compare the complexity and intensity of the surveyed service with the reference service that you have selected. And you'll want to do this in terms of the following 4 components: the time, your mental effort and judgment, your technical skill and physical effort, and your psychological stress in performing the procedure. Next, please. Physician work does not include services provided by support staff who are employed by your practice and cannot bill separately. And that would include registered nurses, licensed practical nurses, receptionists, medical secretaries, and technicians. Next, please. Now, in step 6 involves the question about moderate sedation. And moderate sedation is defined as a service provided by the operating physician or under the direct supervision of the physician performing the procedure to allow for sedation of the patient with or without analgesia. For the purposes of the RUC survey, sedation and analgesia delivered separately by an anesthesia professional, such as an anesthesiologist or a CRNA, who is not performing the primary procedure, is not considered moderate sedation. Next, please. Now, step 7, that's the important one, and that's to estimate the work RVU. This is the final step. You are being asked to consider the value assigned to the reference procedure in developing your estimate of the survey procedure. So the survey methodology attempts to set the work RVU of the procedure that is being surveyed relative to the work RVU of the comparable and established reference procedure. Next, please. How are the surveys being conducted? The surveys are being conducted online. Look for an email in your inbox from gastro.org at softekvc.com. Hate to say it, make sure you check your spam filter as well. Look in the subject line for GI survey for CPT code XXXXX. And please note, each link is specific to the physician being surveyed. So if you have a colleague who would like to complete the survey, please ask them to email their information to surveys@asge.org, and we'll take care of it. Next, please. So let's go over those next steps pretty quickly. You'll receive an email message from gastro.org at softekvc.com. Embedded in the message will be links to the online survey forums, one for each code group. When you click on a link, you will have immediate access to that survey. And please complete all surveys that you have been assigned, because there will be surveys for each code group. Next, please. If you have any questions, again, ASGE and AGA Society staff are available at ASGE Sam Reynolds, sreynolds@asge.org, 630-570-5643. And at AGA, Leslie Narramore, L.Narramore@gastro.org, 410-349-7455. Next, please. Thanks again. And again, we appreciate your assistance in completing the RUC surveys. Have a great day.